Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, I'm going to share 3 secrets you might not know about Ebglyss, the next generation biologic for moderate to severe atopic dermatitis. If you haven't seen the previous video covering the basics of Ebglyss, make sure to check that out, link above. And don't forget to like and subscribe for more science-based medical insights. Now, let's dive in. First, not all biologic medications that target interleukin-13 are built the same. What really makes Ebglyss, also known as Lebrikizumab, stands out is how it binds to its target. In laboratory-based experiments, known as in vitro studies, which are performed outside the human body using cells or tissues, Ebglyss demonstrated stronger binding affinity and a slower off rate compared to other medications in this class. This means that once it binds to interleukin-13, it stays attached longer, helping to sustain its anti-inflammatory effects. This slow detachment may allow for more prolonged suppression of interleukin-13 activity. Based on indirect comparative analysis, this characteristic may help Ebglyss offer a better maintenance of disease control in real-world settings, especially when occasional misdoses occur, which is more commonly seen in daily practice than in tightly controlled clinical trials. So while some biologics have broader receptor targeting or require more frequent injections, Ebglyss works by staying engaged with its targets longer, supporting both stable disease control and flexible dosing schedules, every 2 or every 4 weeks. Second, let's talk about eosinophilia, a life finding that can sometimes raise concern. In clinical trials, elevated levels of eosinophils, a type of white blood cells involved in allergic inflammation, were observed more frequently in patients treated with Ebglyss compared to those receiving placebo. But here's the key. Those increases were rare and temporary. During the 16 weeks of pivotal trials, high-grade eosinophilia, defined as more than 5,000 eosinophils per microliter of blood, was reported in 0.4% of patients receiving Ebglyss and in 0% of those on placebo. These elevations were typically short-lived and did not require stopping treatment. This pattern has also been observed with other biologics that target the interleukin-13 pathway. So yes, eosinophil counts should be monitored, but unless levels are worsening or causing symptoms, it may not be a reason to discontinue therapy. And finally, what about vaccinations? According to the prescribing information, patients should complete all age-appropriate immunizations before starting Ebglyss. It also advises avoiding live vaccines immediately before or during treatment, as no data is available on how Ebglyss affects live vaccine safety or effectiveness. But when it comes to non-live vaccines, we do have some helpful evidence. In a separate phase 3 trial, researchers evaluated the immune response to non-live vaccines, specifically the tetanus vaccine and the meningitis vaccine, in patients receiving Ebglyss. The results were encouraging. Patients still mounted a protective immune response, suggesting that common long-life vaccine remained effective while on treatment. While live vaccines and messenger RNA vaccine were not studied, this trial supports the safety and effectiveness of routine non-live immunizations, including tetanus and meningitis vaccine, while using Ebglyss. So if you're due for vaccinations and planning to start Ebglyss, be sure to talk to your healthcare provider. It's best to complete all recommended immunizations before starting treatment. And there you have it, 3 important secrets about Ebglyss: its unique pharmacologic features, transient eosinophil elevations, and reassuring vaccine data. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based updates right here on Medician. See you next time.